What is an STD? STDs are diseases that spread mainly through sexual contact, including vaginal, oral, and anal sex. However, they can also spread through non-sexual routes, such as through blood transfusions. Some can even spread from mother to child during pregnancy or childbirth. The Social Hygiene Service in Hong Kong diagnosed 12,300 cases last year, and here you can see some of the most common types of STDs diagnosed. As you can see, 564 cases of HIV and 122 cases of AIDS were also reported.
So most of the STDs occur in young people because they're more likely to be sexually active. And there are certain sexual activities which have been shown to be associated with an increased risk of getting an STD. So having a sex without protection, i.e. condom, allows viruses and bacteria which may be present in semen, vaginal fluid, or blood to travel more easily into a partner's body, especially if either partner has cuts in the skin. Studies show that there are other sexual behaviors that are associated with increased risk of getting an STD, and these are called STD risk behaviors or high-risk sexual behaviors. And these include having sex at an early age, having sex with multiple people at the same time, having sex while under the influence of drugs or alcohol, trading sex for drugs or money, having sex with someone you meet online, or having sex with someone you don't know. And there are also other non-sexual risk-taking behaviors that have been shown to be associated with higher prevalence of the STD risk behaviors that we just mentioned. So stronger risk-taking attitudes, greater substance abuse, lower perceived parental monitoring and familial support, and lower student-teacher connectedness, gender role supporting male dominance, and risky peer norms may increase the chance of someone adopting high-risk sexual behaviors, and that would ultimately put them in danger of getting STDs.
Here are some statistics about youths in Hong Kong. A study done in 2016 showed that youths had lower acceptance for multiple dating partners, extramarital affairs, abortion, and compensated dating compared to in 2011. However, in terms of knowledge, they were unable to answer as many correct questions about sex. Furthermore, Form 1 and Form 2 students had less than half of the questions answered correctly, and this could be seen to be a worrying trend. In terms of sexual experience, there were also a lower percentage of youths that have had sex in 2016 compared to the survey done in 2011. And on average, 45% of 18 to 27-year-olds have had sex, and their mean age of first sex is at 19.
Here are some common misconceptions about STDs that we're going to address in this presentation.
All STDs have the same signs or symptoms.
You only get STDs through sexual contact.
Getting an STD test is painful.
It is possible to treat yourself if you have an STD.
HIV equals AIDS.
And you can get HIV from kissing, shaking hands, sharing toilet seats or drinking fountains, eating or going to school or work with a person with HIV.
It's important to note that not all STDs will have signs or symptoms. However, that does not mean that you don't have the infection or that it will not be passed on to your partner. So it's very important to check regularly. At the same time, some of these signs and symptoms of STDs are actually overlapping. Nevertheless, it is important to recognize these major common symptoms, which include sore bumps on genitals or in the oral or anal area, pain during urination, abnormal or smelly vaginal or penile discharges, pain during sexual intercourse, and lastly, sore or swollen lymph nodes. You should particularly pay attention to these symptoms, especially if you have any kind of sexual intercourse lately. Apart from these symptoms, there are also specific features that may indicate a particular infection. For example, genital herpes often presents with small red bumps, blisters, or open sores in the genital or anal areas. You may also experience pain or itchiness around these respective areas as well.
Human papillomavirus, also known as HPV, can present as small flesh-colored or gray swellings in your genital area. Commonly, several warts will be close together to form a cauliflower shape and can be itchy or bleed during intercourse. In addition to being aware of the general symptoms of STDs, it's also important to be extra aware of the following red flag symptoms that warrant a medical check immediately, as leaving these diseases untreated can severely impact your health. People infected with syphilis may find painless sores in their genital area, which will then progress to a rash marked by a reddish-brown, penny-sized sores over any area of your body, including your palms and soles. Oftentimes, this will be coupled with feeling generally unwell, such as feeling tired, muscle soreness, and a fever. Syphilis left untreated can result in symptoms such as paralysis, blindness, and dementia. If you ever experience any of the symptoms mentioned above, you should always seek medical attention or get checked.
HIV stands for Human Immunodeficiency Virus, which is the virus which causes an HIV infection. HIV is not equal to AIDS. AIDS stands for Acquired Immunodeficiency Syndrome, which is the most advanced stage of an HIV infection. The virus attacks and destroys the cells in the immune system, and the loss of these immune cells makes it difficult for the body to fight off infections and certain cancers, making you very susceptible to many diseases. Without treatment, HIV gradually destroys the immune system and you will progress to AIDS. However, many people with HIV can live long and healthy lives by taking antiretroviral treatment and do not progress to AIDS. There are several ways you could contract an HIV infection. You could get it if you have anal or vaginal sex with someone who has HIV without using a condom, from sharing needles or syringes when you use illicit drugs, or in tattoos and beauty plazas. Transmission through blood can also be a result of blood transfusions, but this risk is extremely small because of rigorous screening of blood products in Hong Kong. An HIV-infected mother can also pass the infection to her child during pregnancy, birth, or breastfeeding. HIV is not spread through saliva, sweat, or urine, and you won't get HIV from kissing, shaking hands, sharing a toilet seat, eating together, going to school together, or working with a person with HIV.
So, what are the symptoms of HIV? Within 2 to 4 weeks after infection with HIV, some people, but not everyone, may have flu-like symptoms, such as fever, chills, or rash. The symptoms may last for a few days to several weeks. After the initial stage of infection, you will probably feel normal for many years, but the virus continues to weaken your immune system and you are still highly infectious, which means you can still transmit the virus to other people. Without treatment with HIV medicines, your immune system gets weaker and weaker and your illness will progress to AIDS in about 10 years or faster in some people. So what about the symptoms of AIDS? With AIDS, you are prone to developing severe infections and cancers such as tuberculosis or pneumonia or certain fungal infections that don't occur in normal, healthy individuals. Symptoms of AIDS are nonspecific but can include rapid weight loss, recurring fever or night sweats, extreme and unexplained tiredness, prolonged swelling of the lymph glands in the armpits, groin, or neck, sores in the mouth, anus, or genitals, red, brown, pink, or purplish blotches on or under the skin, or inside the mouth, nose, or eyelids, and painful swallowing. So if you suspect that you may have contracted HIV, look out for any of these symptoms. So who should get tested for HIV? As general advice, people at higher risk for HIV should get tested each year. You are at high risk if you are a female sex worker or their male clients, if you are sexually active gay or bisexual men or male to female transgender, if you have unprotected sex with partners whose HIV status is unknown, if you are injecting drugs or sharing needles with others, or if you have an existing STI such as syphilis.
So now it comes to STD prevention, testing, and treatment. To avoid having STD, we should practice safe sex with only one sexual partner and to use condom during sexual intercourse. You can be tested at social hygiene clinics of Department of Health and private clinics. AIDS Concern also provides testing for HIV, NGU, and gonorrhea. You should seek medical advice as there are different treatment options according to the causative organisms. You should finish the full course of treatment with follow-up and to avoid sexual intercourse before complete cure. Your sexual partner should also receive checkup and be treated accordingly. For NGU, gonorrhea, and syphilis, they are all treated with antibiotics. For genital wart, there is no definite curative measure, but it can be treated with topical medication, cryotherapy, cautery, and surgical excision. For candidiasis, you can be treated with antifungal cream, tablet, or pessaries.
As of now, there is no cure for HIV. However, lifelong treatment with highly active antiretroviral therapy is effective in controlling the disease and slowing the progression to AIDS. When taken properly, these drugs can reduce the level of virus in the body to such low levels that blood tests cannot detect it. Having an undetectable viral load means that you cannot pass the virus to someone else. In the absence of treatment, 50% of HIV infections progress to AIDS in 10 years.
Post-exposure prophylaxis is a form of emergency HIV treatment that must be started within 3 days of suspected exposure. Unfortunately, this type of prophylaxis isn't widely available in Hong Kong. It is only given to the public when doctors believe you have definitely been exposed to HIV. This therefore only acts as a secondary preventive measure and certainly cannot replace the practice of safe sex and the avoidance of sharing of needles. The initial HIV test is usually just a quick and simple rapid antibody test. However, it is important to note that there is a window period of 90 days for HIV testing. The window period refers to the time it takes for HIV to show up on tests. In other words, during this period, you may be HIV positive and be infectious despite having a negative test result. It is therefore important to do a follow-up blood test at 3 months to ensure an accurate result and abstain from sex during this period. In Hong Kong, we also have the AIDS hotline that can provide us with easy access to information regarding AIDS and other STDs. The service is free, confidential, and anonymous.